Thanks for checking out the Psychope Self-Help Podcast, now on YouTube. Our podcast launched on most major podcast directories back in December of 2022, with regular episodes throughout 2023. And now here in 2024, we're making sure all of our episodes are available for the lovely people who prefer listening to podcasts on YouTube. There may be times when the dates don't quite match up, so thanks in advance for your understanding. Please refer to the video description for links to any resources discussed during the show. We'll be sure to point you in the right direction. Hello and welcome. You're listening to the Psychope Self-Help Podcast, a space for women where psychology illuminates paths to healing, hope, and personal growth. I'm Dr. Jennifer McManus, a clinical psychologist, and I'll be your host. Each episode, we'll explore a different way to use psychology to enhance emotional wellness. Hope you enjoy the show. Hey everyone, it's episode 28. I'm back with one more quick episode dedicated to Mental Health Awareness Month. I mentioned on the last episode that today's topic would be on a mental health concern unique to us women. That topic is Premenstrual Dysphoric Disorder, often called PMDD. PMDD is indeed a diagnosis in the DSM-5, which is the manual used by psychologists, psychiatrists, and other mental health professionals when we need to diagnose a mental illness. I want to raise awareness for PMDD by exploring the continuum of menstrual cycle symptoms, from regular menstrual symptoms to premenstrual syndrome symptoms, also called PMS, to PMDD. The reason I want to take this continuum approach to understanding PMDD is because so often women are struggling with symptoms that are far more intense than the normal and typical symptoms to be expected with one's menses each month. But they've accepted these more intense symptoms as something you just have to deal with once a month, not realizing there might be something more going on with their suffering, along with options to alleviate it. It's so easy to make this mistake, though, because there's a lot of overlap with regular menstrual symptoms to PMS all the way up to PMDD. Sometimes the only difference along the continuum is indeed the intensity level of the same exact symptom. And I'm not sure if you saw the title for this episode, but I decided to call it PMDD Sucks, period, because the reality is PMDD can be debilitating. Before we explore the continuum, I want to emphasize the importance of self-compassion, regardless of where any woman may fall on this spectrum. Our bodies are complex, and each woman's experience is unique. So, whether you experience mild discomfort or severe symptoms, please be gentle with yourself and practice self-care. Your well-being matters. Just interrupting here to tell you about a new resource I created for you. If you're experiencing high levels of work stress, this resource is for you. Please know you're not alone. So many women are tired of work stress seeping into every area of their lives. Perhaps you can relate and want to do something about the negative impact work stress is having on you, but aren't sure how to get started. If this resonates with you, then I'd like to invite you to take a brief moment for yourself and try the Your Path Through Work Stress quiz. In 10 introspective questions, you'll learn more about your unique experience of work stress and which science-backed stress relief tools are most likely to help you reclaim your peace. Just head on over to psychope.com/yourpath so you can take the first step down your best path through work stress. The quiz will also be linked in the show notes. Okay, so let's begin by exploring what are considered regular menstrual symptoms. As women, it's common to experience mild physical and emotional changes throughout our menstrual cycles. These may include mild bloating, breast tenderness, fatigue, and subtle shifts in mood. These symptoms are part of the natural variation that accompanies our body's preparation for menstruation. While these symptoms might be inconvenient, they usually do not significantly disrupt our daily lives. Emotionally, you might notice minor fluctuations in your mood, such as feeling more introspective, reflective, or maybe slightly more sensitive. It's helpful to remember that these changes are temporary. Moving along the continuum, we come to PMS. This phase involves a more pronounced cluster of physical and emotional symptoms, typically a few days to a week before menstruation. While PMS symptoms can be uncomfortable, they generally fall within the range of what many women experience. Physically, you may notice bloating, breast tenderness, fatigue, and food cravings. These symptoms can vary in intensity and duration. Emotionally, you might experience heightened irritability, mood swings, anxiety, and mild feelings of sadness or depression. These emotional changes may be more noticeable and can affect your interactions with others and your overall well-being. When navigating these symptoms, it's important to practice self-compassion with your thoughts. Consider challenging self-judgment or negative self-talk that may arise during this time. Many women find it helpful to give themselves a reminder that these symptoms are temporary and not a reflection of one's worth or abilities. Now let's delve into the extreme end of the continuum. Premenstrual Dysphoric Disorder, or PMDD. PMDD represents a significant departure from regular menstrual symptoms and PMS. Women with PMDD experience severe physical and psychological symptoms that significantly impact their well-being and functioning. These symptoms typically occur in the week leading up to menstruation and lessen shortly after menstruation begins. It's important to note that PMDD symptoms go beyond what is considered a normal variation of the menstrual cycle, and the intensity occurs for the majority of cycles over the course of a year. Physically, you may again experience bloating, breast tenderness, fatigue, and changes in appetite, but with PMDD, they're all in the severe range. Emotionally, the intensity of your mood swings, irritability, anxiety, and feelings of hopelessness can be overwhelming. These symptoms can have a significant impact on your daily life, work, relationships, and overall quality of life. If you find that your premenstrual symptoms significantly impair your ability to function or impact your mental well-being, it's important to reach out to a healthcare professional. They can provide a comprehensive evaluation and help determine whether or not you may be experiencing PMDD. Your PCP, gynecologist, obstetrician, or a mental health professional could all be your first point of contact if you're concerned you might have PMDD. Coping with PMDD requires a multifaceted approach. In addition to seeking professional help, self-care practices play a key role in managing symptoms of PMDD. Since there's a lot of overlap in symptoms along the continuum, with an increase in intensity often being the only differentiator, self-care practices can help no matter where you fall on the continuum. From regular menstrual symptoms to PMS to PMDD. Engaging in activities that nurture your mind, body, and spirit can help alleviate discomfort and bring on a sense of balance. Self-care practices aimed at reducing the negative impact of regular menstrual PMS or PMDD symptoms may include practicing mindfulness, engaging in regular physical exercise, maintaining a healthy diet, getting enough sleep, and nurturing supportive personal relationships. Tapping into your social support systems can make a big difference too. Connecting with family, friends, or support groups who understand your experiences can provide a sense of validation and emotional support. Sharing your journey with others who are walking a similar path can create a space for empathy, understanding, and shared wisdom. Earlier, I mentioned showing yourself compassion in terms of your self-talk. Practicing self-compassion towards your body is also important. Listen to your body's needs and honor them. This may involve prioritizing rest and relaxation when you're most vulnerable to menstrual PMS or PMDD symptoms. Consider adjusting your schedule if possible to allow for more downtime during this phase of your cycle. Engaging in self-care activities that promote relaxation and reduce stress can also be helpful. You might consider engaging in gentle exercise or yoga, taking warm baths, or enjoying other activities that you know bring you joy and calmness. Remember, self-care is not selfish. It's an act of self-compassion, recognizing your own suffering and trying to alleviate it. As we wrap up today's episode, I want to remind you that if you struggle with menstrual PMS or PMDD symptoms, you're not alone on this journey. Reach out to healthcare professionals who can provide expert guidance and support. Connect with friends, family, or support groups who understand your experiences. And most importantly, be gentle with yourself. Embrace the power within you to navigate each month with resilience and self-compassion. Please be sure to follow the show so you don't miss the next episode of the Psych Hope Self-Help Podcast. And if you find the podcast helpful, it would be so kind of you to leave a review. This helps other women who might benefit from the self-help topics we explore here find the podcast too. Much peace till next time. The information shared on the Psych Hope Self-Help Podcast is done so with the understanding that it does not constitute professional help, nor is it a substitute for professional help. If you think you might benefit from more than self-help, there are resources listed in the show notes.